Welcome, everyone. And if you're joining us, please enter your name and organization as well as the state you're from into our chat. We'll get started here in just a minute. Again, if you're just joining us, please enter your name, organization, and what state you're from into our chat. We'll get started here right on the hour. Welcome, Lawana. Okay, let's get started. Again, if you're just joining us, please enter your name, organization, and the state you're from into chat. Welcome to Nursing Home Quality Essentials. Today we'll be talking about restorative nursing in long-term care facilities. My name is Nikki Hale, and I'm a quality improvement facilitator with Telegen. And alongside, I have Heather as our chat monitor. Feel free throughout this session to enter any questions you have in the chat. Heather will shout out to me and ask and let me know the questions. Or if you want to come off of mute, that's fine too. We allow that as well. So before we begin, be sure to add QI-Connect at Telegen.com to your trusted list of email contacts. And we are also on Facebook and LinkedIn. Please follow us there. And also, if you haven't already, be sure to sign up for our listserv, Telegen QI Connect Nursing Home Connect. Here, you'll get critical notifications from Telegen, CMS, and CDC. And then you'll also receive information about these type of trainings and events we have. And most importantly, you can engage in peer-to-peer sharing with other nursing homes and kind of learn from each other what works and what doesn't work. There's a QR code there today to sign up if you'd like it. Also, you all will be getting a copy of these slides on Friday, so you'll have that access as well. And then lastly, before we get started, we want to encourage you to take a peek at our assessment dashboard. These are pretty thorough assessments that where you can see where your facility may need improvement, or maybe your facility is doing great in one area and you need to focus somewhere else. So we encourage you to look on there and take those assessments. So as I stated earlier, this is restorative nursing and long-term care. Again, my name is Nikki, and we will get started. So our objectives for today, we're going to define what a restorative nursing program is. I'm also probably going to use RNP, abbreviation for restorative nursing program. We're going to identify the two types of restorative nursing programs and explore the key elements, identify the benefits of implementing, and the steps for assessment and coding of a restorative nursing program. And then we're going to outline the 3 steps needed for restorative nursing care planning. So let's get started. What is a restorative nursing program? So straight from the MDS 3.0 RAI manual, restorative nursing is nursing interventions that promote the resident's ability to adapt and adjust to living as independently and safely as possible. This concept actively focuses on achieving and maintaining optimal physical, mental, and psychosocial functioning daily. So as I mentioned earlier, there's 2 types of restorative nursing programs. The first is a technique program. And on your MDS, there's actually 2 categories for restorative nursing programs. The technique program are programs that maintain flexibility in joint motion. What's important to note with this program is that staff completes this activity with or for the resident. These activities include passive range of motion, active range of motion, splint, and brace assistance, where you're teaching the resident how to apply, manipulate, and care for the brace or splint, or a scheduled program where staff apply, remove, and care for the splint or brace. Also, to mention, the splint and brace assistance minutes include assessment of the resident's skin and circulation under the device, and then repositioning the limb in the correct alignment, and then cleansing the resident's skin and the brace. All of those can be included in your minutes. So the second type of restorative nursing program is probably the most common, and it is a training and a skill practice program. This program improves the residents' self-performance in that ADL, and they're intended to maintain functional declines, are intended to prevent functional declines in ADLs by improving or maintaining the resident self-performance in the ADLs. It's important to note with training and skill practice programs, the resident is actually performing the activity with cues, supervision, and or task segmentation from staff. Keys to I just said that, I'm sorry. So then the training and skill practice would be bed mobility, transferring, walking, dressing and or grooming, eating and or swallowing, amputation, prosthesis care, and then communication. So maintaining independence and activities of daily living and mobility, it's critically important to most people. I know it is to me. And functional decline can lead to depression, withdrawal, social isolation, and complications of immobility, such as incontinence, pressure ulcers. The list goes on and on. A resident actually can be started on a restorative nursing program when they're admitted to the facility with restorative needs, but not a candidate for a formalized rehab therapy. They can also be admitted when a restorative need arises, when they've been a long-term patient or resident, or they can participate in restorative therapy in conjunction with a formalized rehab therapy program. So most often, restorative nursing programs are initiated when a resident is discharged from physical, occupational, or speech therapy. So let's talk about some of the key components of a restorative nursing program. First would be personalized care plans. You're going to tailor the interventions to each resident's specific needs, abilities, and goals. And we will go over in more detail care planning. Daily activities, incorporating exercises, mobility training, self-care practices, and cognitive abilities into the resident's routine so they can maintain or improve their functional abilities. One thing I think of with daily activities is a walk to dine program. If the resident's able to walk and they need to get those steps in, let's do a walk to dine, or helping them with their grooming in the morning time, those sort of things. And then, of course, staff involvement is crucial. Having trained nursing assistants and other care staff to work closely with the residents and to also know what the residents' needs are for these activities makes a big difference with your restorative program. Then we want to talk about continuous monitoring. You want to regularly assess and adjust to the care needs of that resident. That way you can continue to promote the progress or maintain the level that they're currently functioning. And last but definitely not least is resident empowerment, encouraging residents to participate actively in their care and promoting a sense of autonomy and self-worth. That goes a long way when residents have lost so much and are having to be dependent on someone. So now let's talk about why restorative nursing program. To me, the answer is pretty simple because it works. I know if I'm starting to gain weight and not feeling well, when you start doing a little bit at a time, you start feeling better. So you've probably heard the phrase, if you don't use it, you lose it. So restorative nursing can prevent that functional decline in residents. However, the benefits, they extend way beyond that decline. Restorative nursing can also improve residents' functional ability, promote independence, and enhance the quality of life for your residents. With ongoing nursing shortages and increased pressure put on long-term care professionals, restorative nursing programs are often overlooked or put on the back burner. However, implementing a restorative nursing program in your care community is not only invaluable to your residents' quality of life, but it can also be an essential source of reimbursement for your facility. So that helps all the way around. You have more money to spend for different things, staffing, promoting different things for your residents. So reimbursement is always a good thing. Another reason you want to initiate a restorative nursing program is because it helps ensure that your organization maintains compliance with state and federal mandates. So we know all Medicare and Medicaid certified long-term care facilities must maintain compliance with the mandates set out by the Nursing Home Reform Act of 1987. The goal of this act is to improve the quality of care provided to residents of long-term care organizations. CMS also requires organizations to provide the appropriate treatment and services to maintain or improve a resident's ability to carry out activities of daily living. And that's defined in federal requirements for long-term care facilities at 42 CFR Part 483.5, if you want the specifics on that. I also have those two linked on the slide if you would like to look them up. So one other benefit, and a lot of directors of nursing, I'm sure, ears kind of tune in when you hear, they have a potential to impact your quality measures. To comply with phase 3 of the CMS requirements of participation, facilities must have a quality assurance and performance improvement plan, a QAPI plan. So quality measures are an important part of this QAPI plan because they identify the quality of care your organization provides in specific care areas and where you should consider additional training to address gaps. So if you need assistance with developing or any help with your quality assurance performance improvement plan, that's what Telegen does. We're here to assist you. I've also attached a link at the bottom to the slide for with our quality improvement workbook if you'd like to look through that. But importantly, if you feel like you're not maximizing your restorative nursing program, or you don't have a restorative nursing program yet, it's a perfect time to do a root cause analysis to see what you can do differently or where you need improvement, and then initiate that performance improvement plan. Again, if you're unsure of where to start or how to do this, that's what we're here for. At the end of the session, you'll have access to our emails and you can notify us and we'll get you set up with that. So okay, so on with quality measures, they're a part of the 5-star quality rating system, which allows consumers to compare your organization to others within your area. And of course, quality measures are impacted by restorative nursing. If you don't have it, it can be in a bad way. And if you have restorative nursing, it can actually help. So some of the areas that quality measures are impacted would be residents with pressure ulcers. We're preventing them, or if the resident's not getting up and down, we may be helping contribute to them. Falls is a big quality measure that is impacted by your restorative program. So now let's talk a little bit about the RAI MDS coding instructions for your restorative nursing program. We talked about reimbursement. There's several different criteria that you have to meet in order to get reimbursed properly. So if your facility has a restorative nursing program, these programs are coded in the MDS 3.0 section 00500. And when you're coding your restorative program, the resident must have received at least 15 minutes of restorative nursing within a 24-hour period. The 15 minutes do not have to be achieved all at once. They can be added up over a 24-hour period. And the minutes for each activity are coded separately, though. So activities can't be combined to get those 15 minutes. For instance, you can't have 7 minutes of active range of motion and 8 minutes of passive range of motion to achieve your 15 minutes. They has to be 15 minutes in each area. And then, of course, only the time the staff spends with the resident is counted. For example, if your resident is needing brace assistance, you can't count the time that the resident has the brace on. You know, if they're wearing it all day, it's only the time that you're present and taking action with that resident. And then lastly, the minutes, of course, must be documented. Oh, that wasn't last, that was next to last. Sorry about that. And then, of course, it doesn't include procedures or techniques carried out by or under the direction of qualified therapists, such as speech, occupational, or physical therapist. Any questions about anything? I'll slow down a little bit and see if anyone has any questions before we go on to the next.
There's nothing in chat at the moment.
Okay. If you have any questions a week, I'm reading. I'm sorry, I just saw your question. How many days a week do they need to get reimbursement? I believe it is 6 to 7 days a week that they have to have the reimbursement, or that they have to have the 15 minutes a day to get that reimbursement. Any other questions? Okay, so steps for assessment include, of course, you're going to review the restorative nursing program notes and or flow sheets in the medical record. These must be documented in the medical record, and they become a permanent part of that record. Now, for the 7-day look back period, you're going to enter the number of days of which the technique, training, or skill practice was performed for at least a total of 15 minutes during the 24-hour period. All of this criteria must be met to code on the MDS. So first, you're going to have measurable objectives and interventions, and they, of course, must be documented in the care plan and in the medical record. If a restorative nursing program is in place when a care plan is being revised, it's appropriate to reassess progress, goals, duration, frequency as a part of the care planning process. And we will get more to that here in just a minute. Good clinical practice would indicate that the results of this reassessment should be documented in the resident's medical record, of course. So next, you're going to need evidence of periodic evaluation by the licensed nurse. When not contraindicated by state Practice Act provisions, a progress note written by the restorative aide and countersigned by your licensed nurse is sufficient to document the restorative nursing program once the purpose and objectives of treatments have been established. So once you've established your objectives, then your restorative aide can put notes in, and then the nurse, of course, evaluates the notes and signs saying, yes, she agrees. Nursing assistants and aides must be trained in techniques that promote resident involvement in the activity. So whatever the technique is that that resident is having done, whether it's, swallowing, getting set up for grooming, different things like that, of course, your CNAs need to be trained in these techniques. Otherwise, they can't perform them to the best of their abilities. So then a registered nurse or a licensed practical or vocational nurse must be the person that supervises the activities in the restorative nursing program. This is why they have to sign behind the restorative aide. And then one thing that I think some facilities forget is that group activities with restorative are limited to 4 residents per 1 staff member. So if you have a big restorative activity, you need to have 1 staff member for every 4 residents, and it must be maintained during the whole process of that group activity. Also, you must have a system in place to document and prove that you had one nurse for every 4 residents. And then when completing group exercises, you need to monitor the quality of the program that you're giving to each of those residents. It's good to have a group program, but it's also good to do the individualized care because not everyone needs the same assistance. So let's talk a little bit about the components of care planning a restorative nursing program. There are 3 components, and they must be developed after a thorough assessment of the resident's strengths, preferences, and restorative needs are identified. A restorative care plan begins with a clearly defined problem statement. First, identify the restorative needs. So what is the problem? What is it that the resident can't do anymore? What ADL activity are you trying to restore or preserve? What do you want to prevent or maintain? Next, we're going to identify what is causing the problem. Is it a medical diagnosis? Why can't the resident do what they want or need to do? And then finally, what is the effect of the problem on the resident? How do you know it's a problem for the resident? What is the resident showing you? What is the resident's current baseline of function? Identify your starting point. So problem plus cause plus effect equals a clearly defined restorative need. An example problem statement is the resident is unable to ambulate independently related to Parkinson's disease as evidenced by an unsteady shuffling gait and a history of falls. That would be a good problem statement for a restorative need. So then next on your care plan, you're going to need to set a measurable goal. CMS requires that all care plan goals are measurable and not just restorative nursing. But SMART goals are measurable goals, and I'm sure all of you have heard of a SMART goal. The acronym identifies the 5 components of a measurable goal, which is specific, measurable, attainable, relevant, and time-bound. Examples, an example of a measurable goal would be the resident will walk 100 feet daily. Can be very simple, but specific. The final component of a restorative nursing program is the evaluation. And we'll talk a little bit more in depth of the evaluation. The medical record must contain evidence of a periodic evaluation, at least quarterly, and then with any significant changes in the resident's condition by a registered or a licensed nurse. The evaluation is completed to assess the effectiveness of the restorative nursing program. Is the program accomplishing what it was intended to accomplish? Were the objectives met? If not, why? What were the barriers that prevented the resident from reaching their goals? The evaluation should describe the resident's progress towards the identified goal of the restorative nursing program. If a lack of progress is identified, the evaluation should describe the barriers to the resident's progress, and I also identify how you will help the resident overcome those barriers. Resident refusals also must be assessed. Why is the resident refusing? Was the resident on board with the plan to begin with? Did the goal conflict with the resident's preferences or health goals? Do other factors play a role? Are they in pain? Is staff following the program? Is staff approaching this resident at an inconvenient time, say during bingo when Miss Jones does not want to get up and walk, she wants to play bingo? Do staff have time to implement the program? The evaluation must identify the rationale for the decision to revise, continue, or discontinue this restorative nursing program. If the resident is consistently meeting their goals, why do you want to continue the same program? Are they functioning at their maximum potential? Will they decline if the program is discontinued? If the resident's not meeting their goal, would you want to continue the same program? Probably not, right? An example of a goal or an example of an evaluation with the previous goal that I talked about. The goal was the resident will ambulate 100 feet. The RN evaluation could say something like the resident demonstrated, or the RN LPN, excuse me, evaluation could say something like the resident demonstrated this ability daily for the past 2 weeks. Staff believe the resident has the potential to walk even further. However, the resident is afraid and won't attempt to walk farther if staff aren't with her. We'll revise the program to increase the number of feet she has walked and meet with her weekly to talk about her fears and how much she is achieving. This evaluation identifies the resident's progress toward the goal and why the program is being revised. So understanding the importance of restorative nursing and adherence to the care program is crucial for long-term care and SNF staff. Restorative services can provide hope and independence to residents. However, if nurses and assistants aren't trained adequately or just aren't into doing it, and it's not implemented properly, the outcomes can be very disappointing and even devastating for the residents. So we're going to look at explore a story. This is called Jane's story, and this is a story about a situation that went wrong with the restorative nursing program. So Jane was admitted to Sunnyfields Nursing Center following a stroke that left her unable to walk independently. She used a wheelchair to get around, but was receiving therapy services with the hopes that she'd be able to walk again. After 3 months of therapy, the physical therapist determined that Jane was not safe to walk independently, but could walk if the nursing staff were there to help maintain her balance. Upon discharge from therapy, the DON placed Jane on a restorative ambulation program 5 times per week. Her goal was to maintain the ability to walk 50 feet in the hallway with staff assistance of one person. 2 weeks later, the staff at Sunnyfields had yet to provide these restorative services. So Jane mentioned something to one of the nursing assistants. The nursing assistant responded, "We've been short staffed the last 2 weeks, so we haven't been able to provide any restorative services. We'll get to it as soon as we can." At Jane's quarterly plan of care review, Jane informed the DON that she had not walked since therapy discharged her almost 2 months before. She told the DON that she was afraid she was going to lose all the progress she had made in therapy. The DON assured Jane that she would take care of the problem. So the next day, the nursing assistant found Jane in the activity room and told her that it was time for her to walk, but they had to hurry up because she was very busy today. As soon as Jane stood up, she could tell she was a lot weaker. Because of this weakness and the hurry up attitude of the nursing assistant, Jane fell after taking just a few steps and bruised her shin. The next day, Jane's knees gave out on her as she walked. Fortunately, the nursing assistant was able to ease her to the floor so there was no injury. After these episodes, Jane refused to participate again because she feared falling and injuring herself. 3 weeks later, the DON discontinued Jane's restorative ambulation program related to noncompliance, and Jane never walked again. So while the nursing staff at Sunnyfield started out on the right path by implementing a restorative ambulation program, things went wrong, right? And this resulted in a decline in Jane's functional ability. So now I want to open it up for discussion. We have a few minutes left, and I just want to ask you guys, what obstacles do you feel that this facility encountered in treating Jane? You can come off mute or you can just enter your answer into chat. I would just be curious to know what you guys think. What obstacles did they face when they were trying to implement this restorative ambulation program? One thing I can think of would be staffing. Um, there apparently they were short staffed, and that's what the CNA said. Maybe processes. Anyone else have any answers or? Okay, and then what actions or interventions could have been taken to improve Jane's outcome? So I think of one intervention would be uh, communication. Somewhere along the lines, somebody didn't communicate back to the DON that they were not able to walk Jane. That's a big failure there, is the lack of communication. Any other interventions or actions that you feel could have been taken to prevent or to improve her outcome? Exactly. Failure to understand the importance of the restorative program, that's a big one. I know for a lot of facilities, they actually employ a restorative nursing aide, and that's all that restorative nursing aide does. I know occasionally they get pulled to the floor, but they can incorporate their care into their measures on the floor. So, um, thank you for that answer. And so, placing yourself in a resident's shoes for a second, it's plain to see that most of them, upon entry to your facility, are experiencing a ton of loss, both materially and emotionally. They may have came from a spacious house. They may have lost connections to loved ones. They may have lost their memory. And with all of this loss at one time, it's no wonder that we often see a decline in health and wellness of our residents. And restorative nursing programs are one way we can actively help the residents restore or maintain some of their independence and also give them some of that autonomy back. Um, Compared to the size of the grief they may be experiencing, getting back the ability to walk, dress, or whatever their goals are may seem like a very small victory, but to them it could be very priceless for their inner and their outer well being. So any questions? I know we're right on time and I'm trying to talk faster. Um, Establish key performance indicators for the restorative program. Very good, Jaime. Okay, so if you guys would like to take us up on any offers for support, here is our contact information. QIConnect at Telegen.com or nursing home at Telegen.com, and we will get you with your point of contact. I want to mention that we have Nursing Home Quality Essentials every Tuesday and Thursday. This Tuesday coming up is Understanding Social Isolation and Social Drivers of Health. That's going to be a good one. And then the next two after that are Spotting the Signs, Early Recognition in Nursing Homes for Better Care, Part 1 and Part 2. Please join us there. And as a reminder, I want to tell you or ask you to please fill out the post-event assessment at the end of the session. It'll pop up in your browser. And if there's no questions or nothing else to say, I will let you guys go and y'all have a lovely day. Thank you for joining us.